Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN. Healthy world, healthy nation, healthy you. This show is dedicated to you, the healthcare consumer. And today we have an important topic to talk about. The title of our topic today is Reinventing the Wheel: Gadgets, Tools, and Information to Take Better Care of Yourself. Now, how do you do that? You're going to start hearing a term, and we are going to discuss and define this term today, referred to as patient engagement. Now, patient engagement is similar to when you decide to get married, you get engaged. In this case, the person that you're making a commitment to is yourself. So this is a different kind of engagement. And this case is going to require the same elements of any engagement. It's going to require your focus, your commitment, and your direction to really get to a goal. And in this case, the goal is better health and wellness. And our guest today has got a lot of experience in this area, and she's going to be extremely helpful to you in understanding how all of these parts, tools, gadgets, information, and your engagement all come together to really get to a better goal of health for you, your family, your community, and others. So I'd like to welcome our guest, friend and colleague, Marty Minetti. And I'll tell you about Marty in just a moment. So welcome, Marty. Thanks for being with us.
Thank you, Nancy.
Marty is a nurse entrepreneur, and she has really started a company that she is still CEO of. The name of that company is Skilled Nursing, Inc. It is a nurse staffing placement. But the other side of her life is very, very different. And she is the Chief of Product Development for a company here in Horsham, PA, not too far from Philadelphia, called Care Partners Plus Wellbe. Now, what does a product development person do? A product development person in any organization really solves problems. So Marty, as a nurse entrepreneur and as a nurse, got the best job because nurses are very good at problem solving. And in this case, she has found out from patients and families what the problems are, and she and her company sit down and design these products and tools and systems in order to solve these problems. So I think she's very great in her background. She has a lot of skill and a lot of experience, and she's going to tell us today about why patient engagement is important and why you as a patient or your family involved with your care may need these tools and what these tools look like, what they feel like, and she's going to show us some of those. We're going to talk about why this benefits you and your family and how it will make it easier for you as you are going forward. And she's going to tell us about what's on the horizon and show us again how these tools work and how you can have them actually in your hands to make it easier for you to take care of yourself. So with that as our introduction, Marty, please, give us some ideas of where we're going in healthcare with this whole idea of patient engagement. Tell us a little bit more about patient engagement.
So in the old days when you went to the doctor's office or you went to a clinic, basically you went in, you said what your problem was, and you got a prescription. And that was pretty much it. You had to go fill your prescription. Today, the model is changing for a lot of reasons. It's changing because the doctors, the nurses, the nurse practitioners, the physician's assistants, the pharmacists know that no matter what they do, if you're not involved, if you're not following the care plan, it's going to be very hard to get you healthier or get you to your maximum health. And I think what's really changed now is because healthcare has gotten so expensive, people are starting to examine where that cost is. And part of the cost, although people don't like to hear this, is about them. The more engaged you are, the less cost there is. And this has been proven time and time again. Cost goes down by 8 to 21% if you personally are engaged.
Right.
Now, what does that mean, right? Okay,
right.
That's the big question. What does that mean? That means you know something about your problem. Like the topic, do I have diabetes, do I have high blood pressure, do I have asthma, some of those types of identifiers. It also has to do with, do you know your medications? And then if in fact you have a care plan, you're supposed to take these medications every day at 8 a.m., do you actually do that? It sounds like a small thing, but it's actually a big thing. Adherence is a big opportunity to decrease healthcare cost.
But I think in terms of understanding that the role of the patient is vital, it's very vital. In fact, Marty was telling me before we got started on the show today that, to her point about our dependence on physicians or other members of the healthcare team to somehow magically get us better, is really not the reality. In fact, in terms of that team and everything they can provide for us, they really can only impact about 25% of our health by writing prescriptions for us, by giving us some information, by giving us some direction. But the real change that Marty's talking about and trying to educate us about today in terms of patient engagement, 75% is up to you. That's a big burden. That's really where the engagement comes in, because there is no magic to this, is what she's telling us, that it really is up to you. So the up to you piece is really what we're focused on. So going back to what your examples were, that people have to comply with the doctor's orders or the healthcare team's orders. And how are they going to do that in order to get more engaged? Because I think the healthcare providers have known for a long time that we've got to get people to do what we ask them to do.
Yeah, I think that's absolutely true. And the truth is, we know it. And we know as patients, when we go to the doctor ourselves, we know that there are certain things we do every day that we should do, and there are certain things that we do every day that we shouldn't do. And in the end, it's up to us to take care of ourselves better, because without us, obviously, our family suffers. What we see now is this shift where people are paying more and more out of their pocket, or they can't afford to miss work, or they can't afford to miss school if they're a younger person. And the reality is there is this role that has kind of been subjugated to the physician, and it can't be that way anymore. The physician or the nurse practitioner or the physician's assistant, they're there to diagnose, they're there to treat, and they're there to some degree to educate. But in the end, they pass the ball to you. And when they pass that ball to the patient and their family, I'm a big believer of you've got to get the family involved. That's where the everyday action comes in. And it doesn't have to be hard or overwhelming. It's usually baby steps to improve, to get a little bit better. The benefit in the end is for you. Less out of pocket, feeling better, better quality of life, and better longevity.
Right. Well, in another show, we talked about tools that people could have for patient education. We did talk about how a lot of times people do not follow the prescriptions because they really don't understand them. And so there are some opportunities to have a better understanding. And I think we addressed that in another program. And I think we can pull that thread into this program because it is a lot of different themes. And people like Marty are trying to address this by finding ways to make it easier for you. But the first idea that we really want to get across is patient engagement and your willingness and your interest to really take more responsibility for your health in a very good way, a positive way, not necessarily a burdensome way, but a way that you can really feel very good about what you've achieved. And that's really what I think you're trying to help us with.
That's part of my job and our team's job, is really to make it easier for people to stick with their care plan, and stick with simple ideas that can move forward. So I'll give you an example. This is interesting. We had an executive who was in to see a physician, and he was a diabetic. And he had been a diabetic who was not well controlled, meaning his blood sugar was over 200. That's not good. It should be more in the 80 to 100 range in the morning. And he went in to see the physician, had a conversation with the physician, told the physician everything was all right. Came out into the office where one of the products that we're involved with was stationed. It's a kiosk. And he went up to the kiosk, and one of the questions was, do you feel competent to manage your meds? He said no. In that office, that message was connected to the nurse coordinator, and it was a risk alert. So the nurse coordinator talked to the gentleman and basically said, can you tell me what this is about? And he basically said, look, I'm super busy. I cannot remember. Over half the days in a month, I forget to take my meds, or I don't take them at the same time. So she said, would it help you if we sent you a daily medication reminder? Now, that was done on a little device like this. I mean, these little devices that most people are carrying around are starting to become excellent ways to get in touch with people, send a message, or get patient information back.
Okay, so let me just walk through that. You are seeing some new materials and gadgets, so to speak, in your doctor's offices. When you said a kiosk, just describe what that is, because not everybody has seen a kiosk. So just give us an idea of what that looks like.
Sure. So I brought a picture with me today so that we could take a little look at some of the gadgets that are showing up and how those gadgets are really beginning to collect information, important information, patient information that allows your providers to tweak what is good for you. So if you take a look at that picture.
Okay, so let's take a look at this right now. Thank you.
So if you look at the bottom of the page, this boxy type kiosk that's here, kind of in the middle of the page, that's exactly what was in the doctor's office.
So let me see if I can really see that on the slide. So it's in the middle and the bottom of the page. On the right there are the computers, but this thing that is the kiosk, it looks like an ATM machine.
And that's why people use it without any problem. It is like an ATM machine. It hangs on the wall in this particular office. And what it is a large screen, and it produces a survey for the patient. So as soon as the patient touches this screen, what happens is some questions come up about who they saw that day and what they were in for, and then a series of questions are asked, questions that are based on actually national standards for quality. So what's happening is the patient, in their own language, is starting to give feedback. In this case, this is where the gentleman said, I don't feel competent to manage my meds, didn't feel secure.
Right, now you mentioned in that particular example that he did this after the visit. Are people using these kiosks which are drawing information from the actual patient into a machine? Is that usually before the visit or after the visit? How is it really used?
It depends on the application. So just as you're seeing kiosks in the airport and you're seeing kiosks in hospitals giving people directions, or you're seeing kiosks in the malls to tell you what stores to go to, the kiosk is really just a piece of equipment that allows you to help someone.
Okay.
So it's up to you whether it's in the front of the office and you're doing certain types of things in the front of the office, or you're doing it in the back of the office. In this case, for this particular company, this is Welby, we have it at the back of the office because the idea is really to find out, did the patient get what they needed? Do they understand? Do they need more help? And in this case, this particular person, very bright, just very busy, needed more help.
Well, let's just talk about that. It's one thing it doesn't matter whether you're an executive or you're a laborer or a school teacher. That is one of the things in patient engagement that you do have to pay attention to, because this shift between expecting other people to take care of your problems versus you taking care of your problems does require some rebudgeting of time and attention. So here is a person who's very busy in a high-level job, who has a very serious illness, diabetes, that is absolutely critical that he take his medications. It's almost like oxygen or having water every day. You have to have it in order to have that stability with that particular illness. So he deciding that he was just way too busy and couldn't really pay attention to it, and therefore 50% of the time he wasn't taking it, he was really on a trajectory potentially to death. And that is how critically important it is to really pay attention.
So one of the things we did, and it was a nurse and a pharmacist who actually set this up, is we could send different messages through these little devices.
Which is your iPhone.
Which is a smartphone, right.
Smartphone.
So in this case, the decision was made to send a daily medication reminder, which is just the phone goes off and said, did you take your medications? So it's yes or no. If in fact the patient said no, we can then go a little further. Did you not take it because you don't have it? You can't afford the medication? Did you not take it because you're not feeling good? So we can start to get to the underbelly of why did the person not take it. But again, it's very short, it's very sweet. Because this patient was a diabetic, we could also ask, what is your blood sugar this morning? So let's suppose that this, in fact in this case, the blood sugar was 300. The first day, the blood sugar was 300, way out of whack.
Right, because we did say that your normal blood sugar should be 80 to 100 in terms of knowing your numbers.
In the morning, right.
In the morning.
In the morning. So what happened was that was a risk alert, and it went right back to the provider's office, right to the doctor's office, and the doctor then knew that there was a problem. So first thing in the morning, the doctor called the patient and said, what's going on? And adjusted medications right then and there. An interesting aspect for this particular patient, he also wanted his wife to know. He wanted his wife to get an automatic message if he was having a problem. In this case, she also got the message. Now you can imagine that the conversation with the doctor and the conversation with the wife was a little different. And when it came down to it, basically the wife said, "Didn't you have like a huge amount of pasta last night?" And he said, "Yes." And she said, "That's carbohydrate. No wonder your blood sugar is so high." So the wife is having one kind of conversation, importance of family being involved.
Right.
The doctor's having a different kind of conversation. We need to get this blood sugar under control right now. Here's what I want you to do. I'd like you to take another glucophage today. That's a particular pill that some diabetics use. And I want you to test your blood sugar again. So you're absolutely right, Nancy. If that blood sugar is not under control, this is a gentleman who is on a trajectory to get much sicker. He doesn't want that. His
Right.
family doesn't want
Right.
that. So the idea is keep on the page, keep on track daily. And that's what these devices are about. If you take a look at this device here in the middle of the page.
Okay, so in the middle of the page, we're looking at now the thing that looks like a blood sugar monitor, what they refer to as a glucose monitor. For those of you who are diabetics, who are watching the show or no diabetics, just the shape of this is very familiar to you. Mm-hmm. So that is the one in the middle top of the page. Okay.
So most people who have diabetes or even pre-diabetes use some kind of a blood sugar device every day, just so that they can stick their finger, get a little bit of blood, and see what the number reads. The newest models actually can communicate with the internet, and that means it can go right over to the provider's office. So in our case, all of these devices talk to each other. And what's interesting there is, once again, the patient is doing something, getting information, and putting it, either physically putting it into a system like the smartphone, or is doing it automatically by biometrics. That gives physicians and nurse practitioners and the pharmacist and the PAs who take care of patients and the nurses, that gives everybody data they don't usually get.
So in this case, just with that particular device, the blood sugar monitoring device, for older people that are using this, they wouldn't necessarily want to have that in a computer. They may not even have a computer, but that could be programmed so that it could go to their physician and treatment team. That way, other people could have the information to help monitor their status.
Correct.
So I think it's really important to understand the connectivity. For people, you don't necessarily have to have a computer for these things to work at the next level that we're talking about. But your treatment team, and we've talked about medical homes in some of the other programs, they are starting to now have the platform, the computers in their offices, so that when you use this, you're not just reading it by yourself at home at your kitchen table, that somebody else is getting the information, and then they can alert you, or they can have that same conversation that we heard about earlier just a few moments ago. If your blood sugar is spiking out of range, so is that going to become the norm? Everybody that has one of these devices?
Well, I think so. I think what's interesting is there's a lot of people who are not going to be able to afford to just go get the latest gadget. They're just not going to be able to do that. And maybe their insurance company helps on some level, maybe they don't. I mean, you just, everything is changing pretty rapidly. So one of our challenges, we had to build a system that would allow us to get information from anywhere. So we can get information by calling the patient on the phone. We can get it from a mobile device, the smartphones we talked about. In the case of the patients who have a glucometer that's not connected to the internet, the patient can actually still take their blood sugar, and they can just send that information to us by phone, or they can send that information to us by the smartphone.
Right.
So there's lots of ways to make sure that you're not burdening anybody with more cost. But to your point, Nancy, I think we're going to see many, many more devices. If you look also on here, there's in the middle of the page, but at the top, you're seeing a computer. It's hard to see, but it's a stethoscope that's kind of coming out of the computer.
Yes, that's that little picture at the top, to the left of the picture with a woman on the screen of a small handheld device. But I think just to try and translate that for the viewer, this is a small laptop, and out of the laptop comes the arm of a professional with a stethoscope. Now, what does that mean?
This is actually trying to depict a televisit, which is happening much more and will continue to happen much more. So if you look at the younger generation right now, they really don't want to go to the doctor. They don't want to go to a clinic. They want everything fast. Everything comes through the internet. So you're seeing companies pop up all over the place that do telemedicine visits where you can dial in and you can basically describe your symptoms and have a conversation with a provider and get treatment that way. Or you can go somewhere where there's actually equipment where you can measure your blood pressure and it goes through the internet. You can put a stethoscope. You're putting the stethoscope on yourself, but the computer is taking that information and sending it to a provider. So this particular device that's right here is actually a physician who's in Langhorne who invented this whole technology called telemedicine visits, Dr. Raj Shah. And he is all over the world now doing this work specifically.
Now let's just stay with that. So you could have a visit on your computer at your desk at work or your desk at home, and you're actually talking.
Or your smartphone.
Or your smartphone.
Right.
That's even smarter. And that would be a live visit with someone that's communicating with you face to face via a computer or a smartphone.
Correct. And a lot of it is, again, see, this is the patient's role. The patient has to be able to say, these are my symptoms. Or if, let's say, they are a diabetic again, they have to be able to say to the person at the other side of the screen, here's how I feel. This is what I've done. If they haven't taken their meds, they need to say, I haven't taken my meds right the whole month. And as a result, my blood sugar's up. They have to do something like that. And I'm not trying to just point out diabetics. There are people with chronic obstructive lung disease, emphysema, bronchitis, asthma. All of those things have to be monitored daily. So this is really, you know, when I meet with patients, I talk about the fact that when you get into your car, there's all kinds of gadgets in there to help you, right? I mean, you've got the gas, you've got the seatbelt buzzer, you've got beepers going on if you're too close in the front or the back of the car. So you have all these warning devices in your car. And if you see every year your cars are getting more sophisticated, more intelligent, again, because of computing. In this world, what we're doing is saying we need to do the same kinds of things in healthcare. This is really personal health IT. That's what we're doing here.
Information technology.
Information technology. Now, to get very far out there, if you look in the middle of the picture where you see this person's fingers kind of twisting the skin.
Yes, what is that? Is that their actual skin or is that a Band-Aid of some type?
That is a Band-Aid that's actually a biometric device.
Now, biometric, nobody knows what that means for the most part. Tell us what biometric Band-Aids mean.
So this is a sophisticated Band-Aid that has sensors in it, and it can actually measure your blood pressure, your heart rate, your skin temperature. It can even tell a physician, as an example, or a nurse, a little bit of information about what's going on in your body chemically. So this is the future, where we could actually have these super Band-Aids that would read for us 24/7 what's going on. Some of you may have seen products like Fitbit. That's something that tells you how far you're walking and whether you took your 10,000 steps today.
And what was that called again?
That's called Fitbit.
Fitbit.
Fitbit. That's a little tiny device that you put on your shoe or you put it on your pants, and every time you take a step, it's recording it. That information can go right into your doctor, if your doctor has the kind of electronic healthcare record or chart that allows them to do that. There's another device called Jawbone, a little bit more sophisticated. It's a bracelet.
Jawbone.
Jawbone. It's a bracelet that not only looks at your activity level and what you eat, but your sleep patterns. So we're getting very, very sophisticated in being able to collect data. This is the important part. Whether it's a device or it's the patient, we need data from patients to help us help them. Because if we don't have that, there's a whole piece of their life we don't know anything about.
Right. But this is such a different world for people who are used to going to a doctor's office or have a interdisciplinary treatment team to have their diagnosis, their conversations, etc. And this is a different world. I think just even hearing about some of this is brand new information for most of us. Mm-hmm. Most of us feel like if we had a pedometer, which costs next to nothing, and did our 10,000 steps a day and read it on the little window on these pedometers, that would be fabulous in terms of our exercise routine. But what we're hearing about is that there's this new bracelet, the Jawbone, that is doing all that for us. Plus, it's giving us much more information that we can put into a computer, or we can send to our doctor and our treatment team and let them help us interpret our patterns. This is a whole different way of monitoring our health. And I think we started out saying that we are reinventing the wheel. We are using gadgets and tools and getting information that really can help us in a much better way. So, I mean, in terms of what our 3 key points were today, we're talking about why patient engagement is important and why patients need these tools. You may not even think you need them because you didn't even know they existed, but now that you know that they exist, you will want more of these because they will help you and make it easier for you. We've talked about the benefits to you and your family because you are not just your own person, you are part of a network. Your family, your community, your employer. Your health really means a lot to you and to everybody that you spend time with. And then I think with that biometric Band-Aid, that is really what's on the horizon, that we could really wear this patch-like device that would really keep us monitored for everything we need to be monitored for, no matter what our condition is. So tell us really what the new normal is going to require. This is a whole new world.
So the new normal is an expression that's being used to help people understand what their role is in getting active in healthcare. And that's really what the engagement's about, is getting active in healthcare. And the new normal is about providing more information. It can be just by talking to people. It can be including your family. One of the recommendations we make is that every single patient have a person in their family that they rely on as their primary caregiver. They have all their information about the patient. So if the patient does have to go to the hospital, or if the patient doesn't feel well, someone in the family can make a call and have the right information at their fingertips to have a good discussion with the physician or the nurse or whoever it is that is going to take that call. And I will tell you that one thing that the physicians have said to us and the nurses is they want this information. They have to have a way for it to come to them that kind of fits into their workflow also, because they're doing so much in a day. I mean, most providers are seeing 20, 25 patients a day. That's a very fast rotation. So again, one of our roles has been to figure out how to get that information through one system so that they're not bombarded with different messages and phone calls, and do it in an organized way.
Right.
So, but that is the new normal. It's what's happening at home or between visits where we can improve care. What's happening post a hospitalization? Right now, people go home and sometimes they have home care, sometimes they don't, or they only have home care for a certain period of time. Maybe some patients even have a nurse practitioner for a period of time. But the point is, at some point, that help is gone.
Right. So
we have to have a way to connect.
Right. So let me just summarize what we've learned today, because I think that this sounds like Star Wars to some people, and some people are already using some of these tools. So
Yes.
it's really a mixed bag, but it is definitely changing. And I think just to remind us that these tools will help us make those small incremental steps. So they will give us feedback to ourselves about how we're doing, so that we don't even have to depend on having that conversation with someone else, because we will have access to some of our own data through our smartphones, through our computers, or through dialogue with our treatment team. I think the second thing we talked about is it is all about you ultimately. If 25% of the treatment team's efforts help you, but 75% is really up to you, that really is going to require that you spend more time and you use some of these tools, and that will really help you have a more robust and different conversation with your treatment team where you are really part of that. And I think that what we've also said is, to get going, we want to keep it simple. So today was our first conversation of really even learning about what's out there. What is on the horizon? It's moving very, very quickly. Mm-hmm. Marty Minetti is an example of a person who's on the cutting edge of this kind of change. Her job at Care Partners Plus Wellbe is really taking problems and sitting down at the drawing board with her team and designing new solutions. She has shared with us some of what these tools look like and some of the tools that are coming down the pike. So I hope that you've enjoyed this. I've enjoyed this immensely, Marty. I definitely want to get some of these tools myself. So thank you very much for joining us, and have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.